why does this matter? It affects so many people, and it can have profound effects on eroding confidence in people who are suffering from hair loss. It also affects identity, self-image, and can have a detrimental effect on mental health, including social anxiety and depression. We have patients in our office who will not leave the house without a hat on. There's one patient, he's a teenage boy, 17 years old. He wears a knit cap all year round, including the middle of summer, because he does not want to be ridiculed by his peers. We have colleagues whose patients have taken their own lives out of desperation related to their hair loss. So even though there are still some that think that doing something about your hair is solely vanity, it's truly not the case. Let's talk about the biology and the hair cycle. The anagen phase is the active growth phase lasting about 7 years. It's when the follicle is deeply rooted and it's producing a hair fiber. And the longer that hair follicle can stay in the anagen phase, the longer that hair will be. So when we're treating hair loss, we want the hair follicle to get into the anagen phase as fast as possible and to stay in it for as long as possible. There is a transitional catagen phase, and then the hair follicle goes into telogen. Many of you have heard of telogen effluvium, also known as shock loss. This is when the body goes through a metabolic stress, and it actually shifts hairs from anagen to telogen. Normally, we have about 15% of our hairs in telogen phase. In the setting of metabolic stress, half of the hairs goes into telogen. And once the hair shifts into telogen, it's coming out. There's really not anything you can do. But at that point, patients are losing half of the hair on their head, and that's what breaks them in. Usually, we can trace it back to something happening 3 months prior. For example, a viral infection, general anesthesia, or psychological distress, loss of a loved one, or even a breakup. And so once that telogen hair falls out, anagen phase comes in. In fact, some of the medications that we use, and maybe some of you use for hair loss, you'll have patients come back saying that they have a shed after. It's mostly because that anagen phase is pushing that telogen hair out and causing a shed, but you just reassure them that their anagen hair is coming in. Let's see. Here's video. So dihydrotestosterone, DHT, is it's a byproduct of testosterone as a result of 5-alpha reductase. And this is the main culprit for androgenetic alopecia. What it does is it binds to the dermal papilla of the bulb of the hair and results in the hair forming a smaller and smaller hair shaft until the follicle is eventually lost. Other components to androgenetic alopecia honestly cannot be underestimated. That includes oxidative stress, which we've heard about over the last 3 days, that can accelerate cellular senescence. Chronic microinflammation, which leads to fibrosis of the skin and permanent loss of the hair follicle, and that can be compounded by the overgrowth of fungi or bacteria in the setting of seborrheic dermatitis. Impaired circulation, of course, is going to contribute to hair loss, that the hair follicle can't get the oxygen and nutrients that it needs. And if you don't have the nutrients to actually create keratin synthesis, then no matter what you're doing for hair, you're not going to have the building blocks to be able to have true efficacy. So I'm going to go over quickly the landscape of hair restoration approach, starting with the most invasive, and that's hair transplantation. So our office specializes in this. This is one of our most advanced cases. It's best when there's prolonged, permanent, and advanced loss, where follicle is completely lost, or it's only producing a very small vellus hair that can't be reversed. And most of our patients Actually, half of our patients are women, so they need even smaller area, but most patients will have the hair taken from just the back, the most permanent area of the hair, placed into the front where the patient wants to have the most density. And in a patient like this, a hair transplant really is the only way to get the density desired. So minimally invasive surgical, non-surgical treatments, some that you may be incorporating into your practice. I don't need to go into PRP, stem cell therapy and exosomes. Many of you know them already. There are many other things that are used. There are devices that use laser, that use ultrasound waves, and use radio frequency to help stimulate hair. There's microneedling, and there's even mesotherapy. So a lot of treatments that could be used for minimally invasive type level. The non-invasive, we would consider the medications. Finasteride is a DHT blocker that started out in the prostate health space. It is a 5-alpha reductase inhibitor. It is a DHT blocker. DHT is a primary driver of androgenetic alopecia. Minoxidil started out as a blood pressure medication. It causes vasodilation, and it shortens that telogen resting phase and extends the anagen phase. In fact, when patients start taking oral or topical minoxidil, they'll notice an initial shed because that telogen phase has been shortened, anagen phase is coming in, and we just tell patients to hold on when your hair was coming. For spironolactone, commonly used for women for its anti-androgen effects. The things that limit the use of these pharmaceutical medications is the adverse events. Most of the men that I see really are hesitant to start finasteride because of the sexual side effects associated with the DHT blockers. And even though less than 4% of those patients had sexual side effects, it's still something that is prominent on a lot of men's minds, and it certainly does happen, and we've seen it. Minoxidil topical can cause scalp irritation. If you take it orally, it can cause hypertrichosis of the face and the body. And of course, spironolactone is a diuretic. It can cause diuresis and can also affect women's menstrual cycles. So other things that are adjunctive, which we like, is low-level laser therapy. And I just want to make clear that red light therapy is a very ambiguous way of describing what should be more specific. We prefer to use devices that have laser light diodes, still within that red light, or there's some in near infrared light, but the laser diodes give the collimated light that gives penetrance into the skin to the level of the stem cells and the level of the bulb. Whereas LED is more scattered light and doesn't always give you that same penetrance. So that is our preference. So we prefer the caps and devices that have laser over LED. Of course, the cosmetic and camouflage techniques give you instant gratification, but they are not treating the underlying cause. And oftentimes they're causing more harm because they're leading to traction alopecia on top of an androgenetic alopecia. But it's very tempting for patients to go this way, especially when they're desperate for getting more volume. What we prefer, scalp micropigmentation, or SMP. We have this offered in our office. This is a cosmetic superficial pigmentation that can give the illusion of density and also give immediate results, as seen in this before and after of a man that all he did was got the pigment there, and you can see that there's an illusion of density. It's temporary, so it's not a tattoo per se. And also, you can still give these patients the treatments that you would normally give them for the care of their hair loss. So yet there is still a gap on non-invasive solutions and things that patients can do for themselves. And there's only a small percentage of patients that we know actually seek surgery or these procedures or come in to see me or a dermatologist about their hair loss. So what do? Where do they go for information? They go where everybody goes, TikTok, right? And Instagram. And, Instagram, TikTok has many, Andy, if you can help me play all of these reels, I appreciate it. They have a lot of information and 1.5 million things to do about hair. And patients often come in wondering what they can do and what is actually real. And so what patients really want to know when they come to see us is what's real, what is safe, and what is going to work. And that's where this holistic hair restoration model comes in, where you don't just look at one aspect of hair. We like to look at the whole. And so for those of us who are treating hair loss with PRP, peptides, other treatments, if we're not also looking at inflammation of the body, inflammation of the scalp, addressing the patient's nutrition, and also looking at the scalp environment, then we're really doing our patients a disservice. And so this formula, which is based in Ayurvedic medicine, focuses on the whole body in addition to promoting hair. So that's where this comes in with Ayurveda as India's ancient system of holistic medicine, which focuses on harmony between the mind, the body, and the spirit. In Ayurveda, treatment supports the whole body, not just a single symptom or sign.